A health expert says COVID-19 in the Philippines is now reaching the endemic stage.
The health department, though, is cautious on officially declaring this as booster coverage in the country remains low. JC Cosico with the big story.
The country is seeing a slight uptick in COVID-19 cases according to the health department. The DOH reports average daily infection increased from 907 to over 1,200 in the recent week. Despite this, infectious disease expert Dr. Edsel Salvana said the Philippines is heading towards a COVID endemic stage.
Mukhang nagiging endemic na siya in the sense na magsisirculate na yan parang sipon, hindi na siya talaga mawawala ng todo. And so, parang sa mga ganitong klaseng illnesses, meron talagang fluctuations in the number of cases.
However, the health department is still uncertain about this.
We can say that yes, endemicity will come, soon. Pero sa ngayon, it's quite uncertain because of this immunity that we are talking about. We are not certain and cannot be confident to say kasi nga mababa ang immunity ngayon because of the booster coverage which is low and the effect of the subvariants to our immunity in the population.
To improve vaccine coverage, the DOH is planning to hold another special vaccination program on the first week of December. In the meantime, the DOH is looking to introduce changes to the COVID-19 alert level system.
So we'd like to decouple these restrictions from this alert level system kung saan ang alert level system gagamitin na lang ito ng ating bansa parang pag-asa storm signals na lang siya. Nasasabihin na sa'yo, signal number 4 tayo ngayon.
The DOH will also propose to President Bongbong Marcos to extend the state of calamity declaration if the public health emergency bill will not be signed by December.
Even though there is no state of calamity declaration or public health emergency declaration, we can still continue on to implement our vaccination program. We can still do expedited procurement. We can still do the other things that we are doing right now for this pandemic.
With the holiday season just around the corner, health experts continue to remind the public to be cautious in gatherings to prevent the spread of COVID-19. For News 5, JC Cosico, we are One News.
Just how near is the country to reaching the endemic stage of COVID? To give us the answers, we have with us on the show Dr. Edsel Salvana, Director of the Institute of Molecular Biology and Biotechnology at the National Institutes of Health. Good evening, Dr. Salvana. Welcome to The Big Story.
Yeah, good evening, Robbie. Good evening, Gretchen. Good evening to everyone who's watching.
Okay, sir. Again, run us through it again. What do we need to see to say safely that we are already at the endemic stage, and what exactly will that mean?
Right. So important to understand that endemic doesn't mean harmless. Endemic means that we can more or less predict the impact of a disease on our society, like dengue, like tuberculosis, those are diseases that have a real death toll every year, but it is already predictable. It wasn't like if you look back 2 years ago when we didn't know much about COVID, we didn't know how many people were going to die. We didn't know how it was being transmitted. We didn't have any vaccines. We didn't have any treatment. So we have a very different situation now where we can actually now predict, and we can also see that with vaccination and with masking, we've been able to keep the numbers of people in the hospitals quite low. And so we're headed towards that. We're not quite there yet because, there's still some uncertainty with some of these variants. And of course, as we draw down our public health standards, we have to be ready for any spikes in admissions in the hospital. But it really is headed towards there. The first time we started to think about this was actually January of this year, when we had a very high Omicron caseload. It was about 2 or 3 times higher than the Delta number of cases, but we had half of the deaths of Delta. So what that tells you is that the impact of COVID was already starting to decrease, and we continue to see sustained decreases in the severe number of cases. There were only 6 severe cases out of all the cases from last week. And also we see that our healthcare system, our healthcare capacity is not being overwhelmed.
Okay, but Dr. Salvana, how concerned should we still be about our levels of having booster shots? Or as we talk about endemicity, are we past that conversation?
Right. Well, for booster shots, the important target for booster shots are really those that are most vulnerable. We want at least one booster shot for anybody above 12 years old. We want 2 booster shots for those above 60 years old. The US has actually kind of changed that already with the bivalent vaccines coming in, where they just recommend that 1 bivalent booster is enough for everyone, even those 60 and above. But the truth is, our old vaccines continue to protect against severe disease. It's very clear that there haven't been really any spikes in the number of deaths. We see that the severe disease numbers remain low. The problem really is that because of the variants, you do see spikes in cases, but if you're vaccinated, even if you get COVID, most likely it's going to be mild.
Okay, one of the challenges that has surfaced with the recent variants XBB and XBC has been waning immunity of the vaccines. Given that we have low booster coverage and given also the trends in terms of how responsive we are to the vaccines and to the new variants of COVID, what should we be worried about, and what are the trends that we should expect moving forward?
Well, we're talking about 2 things when you say waning immunity. So there's waning immunity in terms of protection from infection because the antibodies are going down. And that does happen, especially with a mismatch with the new variants. But again, the boosters do that with the bivalent vaccines. That's probably going to improve. But the immunity against severe disease does not seem to be waning, actually. As long as we've had 1 booster, we don't see any sudden increases in the number of severe cases, because even though the variants are starting to escape from the vaccines in terms of infection, they're not escaping from that part of the vaccine that protects us against severe disease. These are from the T cells, which are a lot more robust in terms of continuing to provide severe protection from severe infection.
Okay, assuming that we are near or already at endemicity, what might that mean in terms of policies, or at least policy options for government and, for that matter, the private sector?
Yeah, I mean, there's really no distinct point in time where you go from non-endemic to endemic. It really is kind of a continuum. Of course, our lead institution that will say that it's endemic or not will still be the WHO. And they actually met in October to decide on that. And they said, nah, not yet. We're not going to declare it yet. But even WHO Director General Tedros said it's near, but not yet at that time in October. And so rather than having a complete shift from, on to off, it's really going to be a gradual transition. And we're already doing those things. Like right now, we're starting to relax the mask mandates, capacities are high, and then DOH OIC Secretary Vergere is talking about decoupling the alert level systems from the restrictions, precisely because we've been changing the restrictions as we go along, because we're seeing that with a high level of vaccination, healthcare capacity is not suffering so much. And so we've slowly decreased the restrictions even within the alert level systems. And then to the point where when people get used to the idea that, well, if there's a lot of virus going around, or if you're vulnerable, then you can choose to increase your protection by wearing a mask, and if it's available, getting the bivalent vaccine. So it's really moving the onus from government and giving the responsibility to people, because we've had enough time to get to know what this virus is, and we have firm recommendations. So instead of saying you have to do this, you have to do that, it's going to be like, well, COVID will always be with us. These are the things that we can do to protect ourselves. And you decide, especially when the cases are high or if you're vulnerable, how much of these interventions you want to continue doing.
All right, I truly hope it continues on that trajectory and we get ourselves out of the tunnel. Maraming salamat po, Dr. Edsel Salvana, Director of the Institute of Molecular Biology and Biotechnology at the National Institute of Health.